Good afternoon. This is the Ascension Parish Mental Health Board, and we're calling it to order. First, all members are present, and the minutes we're going to have to move to next month because I didn't get them typed. I misunderstood Mr. Randy when he told me how I was supposed to get them. Any two-thirds? No two-thirds?
No two-thirds.
Public comment? Nobody wants to speak. Needs assessment, Ms. Renda.
Okay. I was just talking with Dr. Middendorf about the information that we've gotten so far. I spoke with Dr. McMahon, again, who is the consultant with Robert Rose Consulting that we talked about last month, and who has expertise in doing needs assessments. And what the conclusion we came to at this point is that there is still a lot that we could do as a board and as an agency to gather some preliminary data before we begin to think about contracting with someone and to get a more realistic idea of what the needs really are. So as I was just mentioning to Susan, some of the ideas that we talked about were to look at it from three different perspectives. First of all, looking at it from a public awareness perspective, so finding out through a variety of measures such as focus groups, surveys, contacts with both referral sources and general population, so looking at it actually from two perspectives. Whether or not people are actually familiar with even the existence of the agency and its location, basic information like that. Do they know that we have a location on both sides of the river? Do they know the hours? Do they know the location of it? Then moving to things like, do they have an accurate knowledge about the services that are currently being offered? If you went to someone and said, do you know that Ascension Parish has a mental health clinic, and do you know what services are being offered? Do you know what the criteria is to access those services? Do you know what the cost is to access those services? And so our goal would be to have higher public awareness of all the services that we're offering. I know that the agency does have a trifold brochure that they have out in a lot of places that contains some of this information, but assessment of public awareness would really give us a good idea about how much that's being penetrated and how much people really, are we hitting the right places with those brochures, and are people really knowledgeable about the services. The second area that they recommended we look at are the mechanisms, or making sure that a mechanism is in place for reviewing outcome data that's already being collected. I'm sure Dr. Mindorf and her staff are collecting certain outcomes already, but that's something that we ought to look at. What outcome data do we want to review regularly, both mental health and substance abuse type data? And then looking third, the final part is looking at utilization of services. So a mechanism to see whether the services are being underutilized, whether we have waiting lists, what are the unmet needs that are still existing out there, and then what are the barriers to accessing the services. And she recommended that we look at it both by population, by the service in particular, and then by location. So we may find that there is a need, an unmet need for a certain population to be seen in a certain area, perhaps Donaldsonville, as we've talked about several times. Maybe we're not meeting the need there. It also would really look at barriers, and so why are people not getting to the clinic? Is it lack of information, lack of resources? Is it transportation? So it would really help us to focus on where we need more advocacy for clients to access the services. So we talked about meeting with Dr. Mindorf and any of her staff that she feels would be helpful to the discussion, to see if these are the areas we really think should be focused on. Are there additional areas? Do y'all think this is too much? Is this where we want to go? So I guess what we need to know is, do we want everyone to be present for this? Do we want to all participate in a meeting like that first, or is that something we want to have a couple of us do, and then bring back recommendations to the board, and then have Dr. McMahon come and address the board with those recommendations? What's the feeling of the board?
Madam Chairman, I would feel that we should all be involved in it. I think it's some very, very good suggestions. And I'd also like to ask, is it a possibility that we can get some of the billboards similar to the ones that we already have for the substance abuse?
Yeah, but that's really a different subject.
Okay.
My opinion, it's so hard to get everybody together. You have this going, and I understand it is exactly the way I would like to see it go personally.
Right.
And I don't mind coming and helping, but if you can get a one-on-one meeting with Susan and them, or you handle it and come back to us during the month if you need me, call me. If we can get together with any, you want to meet with any other people, clergy or anything, you want us to do that, we'll do the legwork for you doing that.
Okay, that sounds
Just
good.
let me know where we going, where you want me to go ask these questions and which questions. But that's exactly where I think we should be going with this needs assessment.
And I also think that it'll be a good factor for us to really get involved in. So if you also need me, feel free to call. You know where you can reach me, and
Okay.
I'll help you. It's all for the people.
I'll make sure that I advise all of you of the time that we can meet, and then, of course, anybody who's able to meet can participate, and those who can't, we'll just bring back the information.
Okay.
Thank
Well,
you.
we appreciate that, and looking forward to continuing it till we can get it, and not hurry, but as fast as we can, because we will be better off, I think, when we get this done. Thank you, Ms. Linda. The budget, and Miss Susan has a budget on hers in 4, so we're going to skip 6 and come back and talk to it there. We need a motion to approve to pay the DA.
I'll make a motion to pay the DA.
And I'll second.
Motion made by Jerry, seconded by Brian. Is there any objections?
No objection.
If not, motion stands as approved. We have our report from from the state mental health, and that's going to be done by Miss Murphy today.
Hello, I'm Brandy Murphy. I'm the clinical social work supervisor for Gonzales Mental Health, and I am filling in tonight for Mr. Ryan Reif, our manager, who was unable to be here. Prior to the meeting, I passed out some statistics. If y'all have any questions, I'd be happy to answer those at this time. Any questions?
Any questions?
No questions.
Okay. Well, I would like to use this opportunity to just give some general public knowledge about our agencies. We are available in Gonzales Monday through Friday, 8 to 4:30, except for state holidays. And our phone number there is 621-5770. And we also operate Tuesdays and Thursdays at the Donaldsonville Mental Health Center from 8 to 4:30 on Tuesdays and Thursdays, except for state holidays. And you can reach us there at 474-2007. If anybody has any questions, just feel free to give us a call. The next thing I'd like to discuss is we will have a meeting with some school officials, Terry Caldwell, Kathy Edmonston, and Linda Lamandola, as well as myself and Mr. Stanley Long. We're going to meet on January 26th to go over the services that are provided, as well as to further discuss the possibility of a school-based social worker in more Ascension Parish area schools. So that is in the works, and that meeting will be held on January 26th.
Do y'all have some in the area in the school system now?
Yes,
as
we do.
Speak. What areas are they located?
We have a social worker at the, I believe it's called Lowry Intermediate School now.
Okay, that's in Donaldsonville.
In Donaldsonville, yes, sir. And this meeting is to possibly see about what the need is and possible other Ascension Parish area schools.
Oh, so y'all trying to get some more in the schools? Okay.
Right. We're in the process of collecting some data and meeting with the school officials to see if we can possibly work that out
Good.
with the state agency. Any other questions?
Thank you.
Thank you.
It's nice meeting you.
Nice to meet you.
Ascension Parish Mental Health, Ms. Susan Menendorf.
Thank you. I'm sorry. I apologize again. I spoke to Ms. Gocher earlier. I apologize for not having gotten these materials to you sooner, but the parish had 5 holidays between board meetings, and that put everything too late. I didn't get a lot of this material until yesterday and today, so I'm sorry for the last-minute nature of it. And beginning next board meeting, I'll get everything to you on time. I've included the statistics, and if you'll look at under item 1, if you'll look at the annual statistics, that's a compilation. This is data that you mostly have. I've just put it together in a different form. This is the spreadsheet that has 2 tables on it. That's just something for you to review later when you have time, to show you which services we've provided.
Excuse us just a minute, Beth.
It should say annual statistics at the very top left-hand corner.
It was supposed to be second thing. It's missing. Okay, here. All right.
Okay. I'll get you an extra copy.
That's all right.
There's nothing to report here. I just wanted you to have those data all together for the year. The second insert after annual statistics is called client zip codes. It's the report Ms. Hyden had asked me to run on our client caseload by zip code. And so what we did was take all active cases in 2006 and sort them by zip code. And what we found out was that 10% of our clients live in Donaldsonville, and the rest live on the East Bank, that 78% of our clients live in Gonzales, Prairieville, and Santa Maria, and the rest live in, a small number live in Duplessis, Darrow, Brittany, and Sorrento. So you can look at this again at your leisure. These are all open cases, active cases in 2006, not necessarily cases that were opened in 2006. And the distinction is that some were opened in 2005, 2004, and they were still, not very many of them, but they were still open. You have clinic collections. There are no personnel issues, no update on grants. In your
back
Speaking
to the
of grants.
Excuse me, Jerry.
Okay, go ahead.
Are we applying for a new grant, looking into any new grant?
Always looking into them.
But we're not working on a new grant right now.
Not at the moment, no. I haven't found anything appropriate. I have a couple of small ones that we might look at, and I'll bring those to you. I'm not going to start applying until I bring it to the board for approval first.
I thought I was under the understanding that all grants was offered at the beginning of the year.
No, some have rolling dates. Some are not offered until various times throughout the year.
And do we have the parish grants looking for them for us too?
Mm-hmm. They send me stuff regularly.
Excuse me, what happened to the grant that was supposed to bring new programs to Donaldsonville?
Oh, I reported a few months ago that we didn't get that.
So what happened to the grant prior to the one we already had?
Expired.
It expired, and we never reapplied for it?
We've been through that.
We've been through that a whole bunch of times, yeah. That was a drug-free communities grant. We had used our 5-year cycle, our 5-year funding.
Okay, I know it's in the past, but my question is, why didn't we reapply for that one if we didn't get the one that we applied for?
Because they were both applications were due at the same time, and we could only apply for one or the other. Mm-hmm.
Okay, and whose choice was it that we applied for this new grant?
It was my choice.
So the board didn't have no decision as far as what grant to apply for? From my knowing, I know it was said in the meeting prior to this one, a couple of months back, that we wasn't approved for it. But I'm trying to figure out why did we apply for the grant that we already had?
We didn't already have it. We had finished a 5-year cycle, so we had to reapply. We would have to apply as a new grantee.
So it was your decision not to reapply?
Well, I went through the parish process, and I went through the grants office, and we sat down and looked at all the options. And
So now we don't have no grant for that. No.
I don't think we would have gotten
We
the
lost
drug-free
one.
communities again. I don't think we had a chance in the world to get that.
Well, you don't know unless you apply. That's what I'm
Well,
saying.
that was the one that we didn't spend the money on, and the federal government was pretty critical of the agency for not having spent the money between 2001 and 2003. They told me in not very many uncertain terms that it was pretty badly handled prior
Well,
to
we sure had
2003.
some nice programs on that grant.
That's what I'm saying.
And,
I mean-
and I sure missed the grant, and I still don't understand how we keep saying we didn't spend the money, and then I do know that there was a lump sum and it went out. And I would like to see us try to work towards getting a grant on that order, because that was a prevention grant.
It was.
Can I ask a question about grants? What has been the approach that we take looking at grants? Is it to identify a need and then look for money to fund that, or is it the opposite, where we look at grants that are available and then adjust need or adjust what we apply for based on what we've seen available?
For us, they're about the same thing. In other words, we don't want to apply for a grant that we can't service.
Sure, I understand that. I guess what I'm asking, when I attended a grant writing course about a year ago, one of the things that they stressed to us was focusing on a need and then looking for the money, instead of, as an agency, just looking at what grants come across as being available and then adjusting your need to that. And so I guess I'm wondering, is there a particular need that we're focused on and actively looking for grants to fund? And if so, what is that?
Always looking for anything that'll fund a mental health program of any kind. I'm delighted to
seems
find
broad.
anything, a mental health program that's consistent with the types of services we provide and that we can provide and that there's a need for in the parish. Substance abuse, there are more substance abuse grants, and so it would be nice to have substance abuse grants. The problem is the types of grants that we're eligible for fund specific types of programs. Nothing funds operating expenses. So the grant that Mr. Butler is referring to, that I was so disappointed that we didn't get, the adolescent treatment grant, would have given us a whole range of adolescent substance abuse treatment services beginning in Donisville and across the parish. That would fit exactly in with what we do,
See, that's one of the
what we
questions.
need.
That's one of the questions I had about the grant, because my question is to you is why didn't we reapply for the one we already had before we made a decision to apply for a new one? Now we don't have anything. You
Well,
know,
again,
as far as
I understand
the,
your question, and again, we did that because, first of all, I didn't think there was much chance we could get it, since they were already critical of our handling of it.
I'm asking the question because I don't recall. I recall it coming to the board, but I don't recall us voting on it as a board as far as what grant we need to apply for. I don't know. I don't recall that. And correct me if I'm wrong, board members, correct me if I'm wrong. I don't recall us not agreeing on what grant to apply for and which one not to apply for. Because right now our chances was to apply for the one that we already had. Well, if it get declined, then hey, we try again. But not to jump to another grant source, and now we don't have anything. You know, that's my question.
Okay.
You know, it didn't come to the board. It came to the board, but it didn't come in a way of perspective is that we decide on what grant to apply for and what's not. That's my question to you. So you say you made that decision on your own, right? Correct?
No, what I said was that I went through the parish administration and through the grants office, and we laid out all the options and looked at what would be best for we thought for the agency.
The board doesn't decide on what grant we apply for and what not.
At that time, I didn't bring it to the board. You're correct.
Okay.
That was the case. You're correct at what you're saying. When it was brought to the board, it was a little too late to reapply for that grant. But Ms. Middenoff did state that she had talked with Mr. Keller and administration and what have you, they decided. But it was before it was brought to our attention. It was too late after it was brought to our attention.
And the reason why I asked all those questions about that grant because came back to me from the Minister Alliance of Donaldsonville, came back and wanted to know what was going on with it, because they said to me that you had met with them as far as a new program that you was trying to get over in the Donaldsonville area. Even the mayor of Donaldsonville mentioned it to me also about what happened to the grant, this, that, and the other. But
And when we didn't get it, I contacted all of them to let them know. So
okay,
it took several months to get an answer.
so where are we going from there?
We're still looking for grants, always looking for grants that are appropriate.
But we don't have any perspectives right now of anything.
I don't have any to report on.
Okay. That's what I'm
I'm
asking.
working on it.
Well, and that's what I guess I was trying to get at before was, is there a specific need identified that you'd like to focus on that we could possibly assist in looking for grants on? For instance, you talked about adolescent substance abuse. Is there something that
Sure.
you know of specifically?
Adolescent or adult substance abuse prevention or treatment, any sort of mental health treatment, any sort of specialized program like sexual abuse or parenting skills or any of those things. We can mount those programs. We can develop those programs and put them into effect on the fairly short notice.
I would like you to look into and get back with me within a couple of months or so. Check out the abstinence grant. A lot of programs have out there for abstinence as far as children is concerned.
Abstinence?
Yeah. It's prevention.
Prevention.
I mean, we used to have abstinence program in Donaldsonville. Matter of fact, I was the director over the abstinence program in Donaldsonville, and we had about 40, 50 kids a day, and it was just perfect. But it's just something you can look into,
Thank you. That's a good suggestion. Any other questions on grants? The capital area letter of agreement I got late this afternoon, and I put it in your packet. You have two versions. It's the same agreement, but one shows the deletions and the additions, and then the second one attached to it shows the final form of it. So I think Ms. Gotro wants to defer that until next time.
We're going to go over it as a board, and then we're going to take it to the parish council, whichever committee they put it in front of. So Mr. George told me, and we would go there, and then we would come back to you.
Good.
Thank you.
And the status of the policy and procedure manual. The board's attorney, Jeff Diaz, reviewed the policy procedure manual. I finalized all the changes he requested, and he asked me to give it to present it to Judy G. Orlando, our contract lawyer, who's a specialist in health care issues. Excuse me, and to be sure that we have adhered to all the regulatory issues. So I'm going to meet with Ms. G. Orlando on the 29th of January. I sent it to her 2 weeks ago, but I'll meet with her at the end of the month to discuss that.
And we are also going to take that to a board, a council board. I don't know exactly who George is going to put all these in front of, but since they are also the governing body of this parish, over this board, it has to be approved by them too.
Is that something you will handle, or is that something my office will handle?
We will handle that.
Okay, good. Thank you. Number 9 is programs and operations. The board asked me to find out how many offices were available in the Donaldsonville Clinic. The parish has 7 offices. 3 are available. 2 are currently being used by the parish, and 2 are being used by the TASC. And TASC would like another office we talked about last month.
If we give all our offices away, how are we going to have offices for our parish people to come in?
We're not giving them all away, Mr. Butler. Besides, I'm sure if we need an office back, we can ask for it. But whatever y'all want to do.
Question. How many offices does Ms. August and Ms. Brooks use as the new hirees? 2? 1 apiece?
Well, they run 2 different groups. They run a child group and a parent group, so they're using 2 different rooms. But
Okay.
they're there after hours.
Okay, that's 2. And the state uses how many?
I think the state has 6. That's on your
Excuse me, and I don't want to interrupt, but in the letter of intent we just wrote, do we have how many offices they are going to have in that?
No.
Okay, so if they wish to come back and want another office also, we have to,
You're talking about the state or about task?
no, the state. They're going to keep their 6 and that's going to be it.
Well,
In the letter of
I
intent,
think when you read the letter of intent, what you're going to see is we say we'll consult if there's any change in their use of space. We'll consult
Okay, well,
with
what
them.
I'm trying to do is organize the space where we don't put more people in there than we have offices.
On the program.
And I'm not trying to be rude to you, Miss Susan. I'm trying to say, does this... I don't know. Okay. We will renegotiate with office space as it comes available, or if it does not come available then.
But what we're talking about here is for the truancy assessment program, not the state.
Right.
Okay.
But we are bound to determine that we're going to get some clients saw in Donaldsonville, and it may be way up in the middle of the year before this happens. So we just are trying to make sure that we do not occupy all offices.
Correct.
And we do see clients in Donaldsonville every week.
And I have a question on that too, because we don't want to, how can I put this? We don't want to say that this is a mental health building, okay? We don't want to put all these truancy officers, FINs, or whomever they may be. We don't want to collaborate all these people in this mental health building and not forget what this building is there for, okay? So, I mean, we don't have, myself personally don't have a problem with the space. As long as we don't forget what that building is there for. The building is not there for 1,000 different programs, okay? It's there for mental health treatment, okay? That's what we have to look at, okay? But if we keep putting all these people in the mental health building, then that's going to push us further and further back as far as what we're trying to accomplish. Don't get me wrong, not just because it's Donaldsonville. Even if it's a Gonzalez building also. If there's office space available, we can look into it. But we also need to not to forget what this building is there for. Okay?
Well, it's your decision what you want to do. Task asked for the office space. I'm bringing it to the board. I have no investment in this. So,
Okay, I would like to see a letter of agreement with FINs.
I believe we have one.
I don't know if
I
we
don't
have, we've
remember. I'll
never
have to
discussed
check.
one. So Finn has 2 offices there in the Donaldsonville
Yes,
office?
We approved too.
Yeah, and the parish has one. I'm working on the number.
Okay, darn, I'm sorry.
Yes? I'm sorry?
The parish has 1 office is using?
No, the parish
One
has,
office? How
we
often?
only have somebody over there one morning a week.
One morning,
We
not
have-
2? Not 2 days?
Well, it depends on the need any given week, what services have to be provided.
We should have somebody over there twice a week.
Well, sometimes we do have somebody twice a
It
week.
should-
It just depends on the week.
You know,
People call and make an appointment, and we schedule them. And if they want to be seen in Donaldsonville, then we make those
okay,
arrangements.
what you do in a situation if a person don't have a phone? Then what? My question to you is why we don't have nobody in that building twice a week? It's enough we open just twice a week, not 5 days a week. As much as I'm trying to get it open 5 days a week. And we not open 5 days a week, therefore we paying people in the Gonzales area, in the Gonzales mental health, to have someone over there twice a week, not once a week.
Now,
twice a
Gonzales Mental Health is there twice a week.
Okay?
We're a different
They're the
agency.
state.
Yeah, I understand that. But
No.
still, we need 1 hour workers in that building, parish-wide,
Doing
twice
what?
a week.
What would you have them do?
What you got them doing in the Gonzales building?
Working
That you're
very
not doing.
hard.
Well, it's a parish thing. Whatever you do in the Gonzales building, why you can't do it in the Donaldsonville building? We need somebody in that building, bottom line, twice a week.
Well, and perhaps the
Even if you have to go over there.
will show that.
1 time a week.
Jared, excuse me. When we get this needs assessment and we find out what's going on, and we should have a live body in that office, in that building. I'll agree with you.
That's my
But would
concern.
you give me 2 months, and we're going to have some kind of program to come back, and we will make a motion to put somebody there, And if we make a motion and say we put somebody there and it passes, it passes. But would you let me work, will let us work
Okay,
on
I don't
it
have
for
a
2
problem
months
with it.
before we, I don't
Right.
mean to cut you off or anything, but I'm just trying to figure out how to meet the needs of Donaldsonville,
Okay.
even though, and I talked to some people from over there, and they tell me the need is there, that people are just eerie about coming or whatever. And we're going to have to get them involved as well as putting somebody in the building. Okay?
And I don't want to make it look like every time I say something is about the Donaldsonville building. Okay? Like I said once before in previous meetings, we're all in this here as one to do a job and to get the job done to meet the needs of the people. And I'm enforcing Donaldsonville because we behind. Okay? The building is in the 70s. We are behind. We're trying to catch up. Okay? And I'm going to see to it that it gets done as long as I hold position on this board. Okay? But I'm for everything with Gonzales. I'm for everything Donaldsonville. Like I said before, it's a parish thing. And if we got, off the top of my head, we got 30 workers in Gonzales. Gonzales is open 5 days a week. Donaldsonville is open twice a week with one worker over there once a week. I mean, they're pushing us back and back, further and further, you know. And the only way we're gonna move forward, and we need the service just as bad as Gonzales needed. Okay, we know of some people right now that's not getting services in Donaldsonville, you know. And I keep dwelling on the same thing every meeting, and I'm trying to stop that. So I'm hold out another month for Miss Italia and let her handle that as chairman of this board, as far as getting us a live body over there, human body over there, twice a week. Okay, even if the workers have to go on a rotation basis.
Well, I don't have any problem sending somebody
Okay.
over there, but you're going to have to fill a position in Gonzales for me. I mean, you can't take one of my positions and send them over there to sit.
My question still is to you: what they do in Gonzales? Why it can't be done in Donaldsonville?
Because
It's
the work
same
is
thing.
interactive, and the 5 clerical staff members that we have
Okay.
all work together
I
on
don't have a
different
problem with
aspects
that.
of the same
I
function.
don't have a problem with that.
Okay.
But then, as director of Ascension Parish Mental Health, I would like you to go over there once a week. Then, if one of your employees can't go, why you can't go? As long as we got somebody in that building twice a week.
Well, when the board makes that recommendation, we
I can make the recommendation right now. I make a recommendation that Ms. Susan Menadolph spend at least 1 day a week in the Donaldsonville clinic.
Is that a motion?
I make a motion to that.
Second.
Well, I think maybe you all need to
think with
hire a
this-
new director because you can't interfere with my work.
I think
like
with this
that.
need assessment and this
I
plan
can't write grants
is about taking care of what Mr. Butler's concerns are.
Right.
I
And
think so, too.
Might I state that this is not only Mr. Butler's concern?
Yeah.
I feel this should be a concern of this whole board, and I do believe that it is. So therefore, we already have a motion on the floor. And I'd like to suggest we not give any more office space to anyone until we follow
Wait,
this
we got
through.
another motion on
That's
the
what I
board.
just said.
On the board,
So I can do it after we clear
uh,
this motion,
Okay.
and then I'll make it.
Any objections?
To what? I'm confused on what we're voting on at this
To send
point.
Susan twice a week to, or once a week to Donaldsonville.
I object at this point. I am not for that until we establish a need. If you look at the number of cases that by zip code, I agree that Donaldsonville is being underserved, but we have to establish a need there first. And there's no way to
But-
meet the need that's already established in Gonzales.
There is a need.
I believe there's a need, but
That's a
we
big
have to
need.
establish that. To
Yes.
just say I know a person that needs services isn't
I
enough to
understand.
justify having someone.
But we only open twice a week, not 5 days. And we can't
understand.
release one employee to go to Donaldsonville twice a week.
If you, you're going to vote, hold, please. You vote for or against?
Against.
Against. Okay, it's a tie, and I'm going to vote against it, and I'm going to ask y'all that we come back in 2 weeks and we make a motion to hire somebody to be in Donaldsonville 2 days a week when we get some needs questions to be, or a job for this girl to do. Would that be?
Do we have finances to hire another employee to be a director over Donald?
Well, we can hire a secretary for this board, and we can put her over there. There's a lot of options I have out there right now, I think. And I want to go to the council. I promise I will bring it back at the next meeting.
Okay, another question. Since that didn't.
Can I make a statement?
Okay.
On the reason the needs are low, there's a telephone you call over there. They will. You have to call back to Gonzales if you don't get an answer. So a lot of people are being referred to the Gonzales branch.
Yeah, that's the problem.
And it's scarce. I understand. I know that. I understand that, and that's why I said we're going to work on getting somebody there for 2 days a week.
Okay, another question. I've been a director in many programs also, and I know if I've been a director over recreation, over the whole parish of Ascension in Biddy basketball, which don't have nothing to do with mental health, but I'm just telling you the needs of a director. A director should be able to go to Donaldsonville, if it's once a month, just to see how's everything going.
I agree with you.
But our director undoubtedly don't go there. Okay, she doesn't go there, and she should have at least show up sometime. You know, if your employees can't go, you go. That's my point. Somebody need to be in that building.
Okay.
Somebody need to be over there. I mean, and the director should go no matter what. She should be over there, whether it's to do an inspection or see what the needs of the workers need or whatever. Something. We paying her to do a job for the parish. We're not paying her to do a job for Gonzales. Okay? That's my point.
Yes, sir.
So she should be going to Donaldsonville.
As far as inspections and repairs, we've allocated funds into the budget to repair the building over there, and we're not sure as to whether it needs repairing, if the roof is leaking or what. So we really need someone to be over.
Somebody need to be over there
to go over and make sure that these things.
We had the roof inspected today.
Can we?
Yes, ma'am.
Okay.
Excuse me.
We're going to move on, please.
You were saying something, Ms. Susan, about the roof?
So the roof was inspected today, and so I hadn't gotten the report yet. Let me finish up, please. So what is the status of the fins, the task? You're not going to give them another office? Did that?
A motion?
That's Mrs. Sutton.
I'll make a motion that we do.
Does anybody want to second it?
I'm against it.
It fails for the lack of a second. We will come back and we will refer it back to committee.
Also in your materials is the clinic inventory for Donaldsonville, just to add that to your other part of the inventory. The parish owns very few things in the Donaldsonville clinic. Most of it's owned by the state. The last thing I wanted to tell you that's not on here is that when I delivered the capital area treatment and prevention invoices that I do every month in Baton Rouge, I talked to Mike Steinkamp, and this is just a heads up. He said that capital area is considering requiring an intensive outpatient program for all of their outpatient substance abuse contractors. And he didn't give me any more details. He just wanted to let me know that they're thinking about that. I'm assuming that won't come due until their fiscal year, which begins July 1st. So that's something to keep in mind. When I know more about it, I'll let you know. I asked him if they were going to pay for it, and he didn't give me an answer. But
and how would that impact?
How would that impact us?
Oh, well, we would have to develop a whole new program to go in with our outpatient services. Intensive outpatient is 9 hours of outpatient programming a week. And there's no intensive outpatient program anywhere in Ascension, and so we send the people to Baton Rouge. And capital area would like all of their outpatient contractors to have that program, to develop it and operate it. So,
and that is something that
we'd have to hire a new position. This is the position that Ms. Gautreaux and I have talked about that we're holding back right now.
Right.
So that's just something to think about. That hadn't happened yet. When I get more details, I'll bring it. So, any other questions on my material?
I have one
sure.
other question, Susan, please. On the chart you gave us, when you look at the
Which
intake,
one, Randa, are you on?
the analysis of 2006 activity stats, looking at the bottom, mental health and substance abuse counseling stats for 2006, and looking by month at number of intake calls, and then the number scheduled and number kept, there's a high number of intake calls as opposed to a low number scheduled and then a little bit lower kept. Do you have any ideas about the majority of those intake calls? Are they primarily for information, or are they primarily people trying to find out about our services, or are they people needing services that perhaps don't qualify?
No, most of them are for people who want to schedule a service, and we set them up and they don't come.
Well, but like we
Sometimes
had
sometimes the
194.
informational calls too. You know, what is the procedure? How do I go about getting my husband to call in and make an appointment? My child is having difficulty. I'm not sure what to do about it. What do you recommend? So we, walk them through the steps and the services, and sometimes they're community referral responses.
So like 109 for January, for example, 194 intake calls and only 32 got scheduled. So were the majority of the others information and referral type calls?
They may well have come to orientation. I don't keep any statistics on orientation. Orientation is an initial group that we don't charge for. People come and find out about our services, and we talk to them about their particular needs and how they fit into the program and whether or not they're interested in doing it. And then when they give us all of their material, they have to give us a proof of residency and a proof of income. Then we can schedule them for an appointment. But a lot of people come to orientation and don't make an appointment.
And do we have any idea about why that might be? Because, that's a huge difference, and I guess I'm just wondering, I'm not very surprised by the difference between the number scheduled and the number kept. In fact, I think that's pretty high, and I would assume part of it is because of your orientation process and information there. But it's a huge number between the number of intake calls and the number actually scheduled. And I guess I'm just wondering if we have any idea about why so many who may come to orientation don't follow through.
I'll ask the clinicians and see what their thought is about that. We fill out a sheet on each call, so we write a little brief history and why they're calling and what the outcome of the call is. And so I ought to be able to get you some more information on that.
Okay. And do you have numbers of those who go to orientation and just didn't put them here, or is that not something y'all keep at all?
I actually don't keep those, but I can count. I can go back and count them. We have them in a book. I just don't keep a statistic on them.
I'm just wondering if that might be something that would be helpful for us to know when we're looking at public awareness. Is it something that perhaps we could address?
There's a phenomenon in mental health called the instant cure. You pick up the phone and call for information, and then people decide, well, okay, now we've got to solve this problem. And, so some of that is at work. Some of these are just informational calls, and I don't mean just informational calls, but they're wanting to know what services. We might refer them to Gonzales Mental Health. We might refer them to the school system for testing, to FINS, to other people. But I'll go back and look at some of that and see if I can put some of that together for you. That's a good question.
Thank you.
And the other thing, we didn't get a report on our groups tonight. We'll get that next month.
Our groups?
Group sessions.
Oh, okay.
That's okay. We have enough information tonight. Just we'll keep up with that one.
Okie dokie. I'll have anything else?
Dr. Midnow,
Yes.
can you accept 2 compliments 2 months in a row?
Oh, that'd be hard, Miss Baptiste.
Again, I want to compliment you on the billboards that are out there. My question to you, according to your knowledge, is it possible for us to put up some with information for mental health?
Sure. They run somewhere between $5,000 and $10,000 a billboard, depending on the size and the location and the number of months they're up. But yeah, that'd be a terrific thing.
Why don't we put the billboards on the TV channel?
Yeah, I was going to bring that to your attention. I asked Miss Talia about that earlier. Is it possible we can get something, get with communications and see when like in between the times that they don't air anything, flash some, our location, where we are, what we about, what we do, whatever. Just something need to be on that as an advertisement, if we could.
idea.
I was going to bring it up on the new business, but it lined up creeping up here before. So you know how that is.
Thank you, Ms. Susan.
Thank you.
Oh, wait.
Anything about old business?
Yeah. What is the status on the remodeling of the Donaldsonville building? I heard she said today, Miss Susan. I heard you say today something about the ceiling with the. I wanted to cover that when you got to facility operations and maintenance.
The roof leak, the leak by the back window's been fixed, was fixed in December. The roofer was there today to see if there was any roof leak. The state employees didn't know of any roof leak, but they were going to walk him around, and he was going to
Has the glass been repaired in there?
I'll have to check and see.
There's the door, the back, in the back door area. It's a cracked glass. I don't know if a rock hit it or what, but it's shallow. It's over the back door,
Okay.
and the back door is almost rotting out. I guess it's from the rain and the water and the wear and tear from an old door, but it's peeling, it's coming off, and it just. But my question to you was with the ceiling was that the reason why I knew it probably had a leak is when I was walking through, I saw they had different rust stains, and and those can be replaced. You can just slide those out and slide them back in. So, and there's a cracked glass in the front door also.
Okay.
And my other question is, have the back of the parking lot been striped yet?
No.
What's taking that so long? That's been over 2 months now.
Well, we turn
What's the
in work
problem with
orders. We
that?
did a work order on that a long time ago, and
That's
so
what I'm
we
saying.
have to follow up on it.
Well,
It just takes time, and they get to the most urgent ones, and that's probably a lower priority. I don't
Because
know.
I know they just striped the front, but they didn't stripe the back.
Right. I'm sure it'll get done eventually, but I'll
And one more thing, the sign that's out there. You can't make I guess because of the rain, once again, you can't really understand the letters that's on the sign itself from a distance. You really have to go all the way up on the sign to really know that the building is there. And you wouldn't believe the people in Donaldsonville don't know that building is there. Behind all those years, a lot of people don't know that building is there.
That's because we don't have the proper advertisement.
We don't have, yeah. But a lot of people in Donaldsonville area, maybe that might be one of our factors why. I know before you said they wasn't meeting the needs for their appointments. Well, a lot of them don't know. All they know is Gonzales, And I don't have a way to Gonzales. I mean, well, we have a building right there, and they didn't even know nothing about it. So we need to look into maybe ordering another sign or getting it repainted or whatever. Okay.
Anything else?
New business.
That one.
New business.
Somebody make a motion to adjourn.
I'll make a motion.
Jerry made it, I'll second.
Oh, thank you. This meeting stands adjourned.